I am sitting here having a fascinating conversation with Don Duff, so come on in and join in with us. Don is a multitude of things, but he's here today on behalf of the Spine Motion Institute at Rhea Medical Center. You were a chiropractor for years, became a nurse practitioner now, but you have been embedded the last 10 years in this passion really for you when it comes to spine health and recovery. Is that fair to say?
Correct, yeah. I've been doing spine work for over 35 years, and that has given me a lot of perspective for rehab type care, conservative measures, what we can do before surgery. And so that's one thing that we're able to bring to the table with the Spine Motion Institute.
I was not just giving you lip service when I said it's this fascinating conversation the two of us have been having, because Don is so passionate about what they do. You're really having a lot of innovative experiences, it sounds like, at this Spine Motion Institute. Just opened over the summer. Is that right?
Yes, ma'am, in July.
But the key word really is motion,
That's
not
right.
spine. You're trying to allow people to have that fluidity that your spine needs to be as healthy as it can be.
That's right. We believe that the good Lord designed our spine to move, just like other joints. They're all designed to move, and when you stop that motion with fusion type procedures, you change the biomechanics forever, and you cannot go back and restore that. And there's sort of a long-lasting effect for that, and you begin to break down other joints because now you've lost the normal mechanical function.
Right. So we're going to talk a little bit about some surgical interventions that they can do there, but before we do, not everybody who comes to you is going to need that. You do whatever you can to help them in other ways.
Correct. My role at the Spine Motion Institute is I'm a nurse practitioner, and I have, again, done thorough workups for spine patients for years. Our surgeon is Dr. Scott Hodges, and he performs the procedures, and he's world-renowned and has been a surgeon in this community for many years, more than 30 years. So he and I have worked together for more than 10 years, trying to innovate spine to a motion into a motion paradigm. So we want people to think about their spine and maintaining, or restoring motion rather than fusion.
Okay, so I'll tell you what, let's talk about what y'all are doing innovatively. Okay. And then if there's time, I'll ask you something that's not surgical. So one thing, in 2023, the FDA approved something called a TOPS procedure.
That's right.
Done in Europe before.
That's right.
Y'all were the first ones in Tennessee to do it.
We did the first case, I think it was in August or September. The first case in the state of Tennessee we did at Rhea Medical Center.
And tell us what a TOPS procedure is.
Yeah, so a TOPS procedure is a motion restoring or preserving procedure where the facet joints, which is the posterior aspect of the spinal cord column, the posterior column is removed, which allows you to unpinch the nerves. But you have to restabilize that spine, and the TOPS procedure is a stabilizing facet replacement, which allows motion. So when you replace with this TOPS procedure, you still maintain motion.
So if you've ever had somebody who said, yeah, I had to have a spinal fusion, that facet was removed.
That's right.
And it was fused.
That's right.
This is the facet removed, but now it's something that's got the fluidity, the ability to move.
That's right.
In its place.
It maintains the normal motion of the facet joints. That's right.
Okay. Something else you're working on currently, unless it's already has happened, is this a clinical trial?
Yes, ma'am. We've just completed an FDA clinical trial for a new device. That device is called MOTUS, M-O-T-U-S, and the company is 3 Spine, the number 3, the word spine. So 3 Spine is the name of our company that has been working on this project for more than 20 years. Dr. Hodges and I have been working on it with an amazing team. We did over 100 cases outside the U.S. as a pilot study. And then in the U.S. FDA trial, we did over 150 MOTUS cases at 20 different sites around the country. And we just finished our last data collection. And now we're waiting for the FDA to give us our final approval. So we're hoping later this year to be able to, at Rhea Medical Center, be able to start utilizing this new device, which is a total joint replacement, meaning it replaces the disc and the facet joints. So it allows us to unpinch the nerves and restore motion at the level.
Much like you said a hip replacement would or a knee replacement would.
That's right. They used to fuse hips and knees. Now there's replacements for hips, knees, ankles, shoulders, elbows. There's replacements for almost everything.
So, okay, I mean, if you begin to have back pain, that it can be life debilitating.
Absolutely.
For so many people. Sometimes it's just a nuisance, but you don't want to let it grow. So if people are watching and they think, okay, maybe I should go see him, can they make an appointment on their own? Do they have to be referred
Absolutely.
to you?
No, there's no referral necessary. They can just call the Motion Spine Institute at Rhea Medical Center, and we do have a number we can provide.
Yeah.
But folks can just call, and we'll schedule them in, and we'll do a good, thorough workup. A lot of people come to us for second opinions. I have people that actually come from literally all over the country. We've had a guy from Hawaii that's come. We've had 4 or 5 patients from Pennsylvania that have come down to see us. It's just sort of a network of people that have utilized our services in the past, and they just trust us to give them a good, honest opinion.
Is your philosophy that conservative is always the best way to start?
100%. We always start and exhaust conservative care. We never recommend surgery until we've exhausted conservative care, unless there's some compelling reason like a neurological deficit or some type of significant, urgent issue neurologically that would promote that surgery to be done immediately, but that's rare.
Well, you are totally justified in talking to me until I said to you, wait, we got to go on the air, so hold it just a second. He is passionate about what he does, and what he does is help you to recover and not have to live with that pain. You can learn more at the Spine Motion Institute
at Rhea Medical
part
Center.
of Rhea Medical Center. There's their phone number, and raymedical.org. You can learn more that way too. Great to see you.
Thank you.